Xigduo XR is a combination of two drugs, dapagliflozin and metformin. It's used with diet and exercise to control high blood sugar in people with type 2 diabetes. This helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. Xigduo XR is also used to treat kidney disease or heart failure in people with type 2 diabetes. It helps to lower the risk of death from heart disease and reduces the need to go to the hospital to treat heart failure. Xigduo XR works by helping to restore your body's proper response to the insulin you naturally produce, increasing the removal of sugar by your kidneys, decreasing how much sugar is made in your liver, and decreasing how much sugar your body takes in through your stomach and intestines. The usual starting dose of Xigduo XR is 5 mg of dapagliflozin and 500 mg of metformin taken once daily in the morning with food. Your doctor may increase your dose as needed until your blood sugar is controlled. It is best to take Xigduo XR at the same time each day. Before you start taking Xigduo XR, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the morning with food. Swallow the tablets whole. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Take this medication regularly to get the most benefit from it, and to help you remember, take it at the same time each day. If your condition does not improve or if it worsens, make sure to tell your doctor. If you experience any of the following side effects, tell your doctor or pharmacist right away: headache, diarrhea, nausea, vomiting, runny nose, or sore throat. If stomach symptoms persist or come back after several days or weeks of taking the medication, inform your doctor immediately, as it may be a sign of lactic acidosis. You may also notice an empty tablet shell in your stool, but this is harmless. If you experience a urinary tract infection, signs of kidney problems, or a new yeast infection in the vagina or penis, contact your doctor right away. Additionally, seek medical help immediately if you experience any pain, redness, or swelling in the genital/anal area, along with a fever or feeling unwell. This medication may cause dehydration and lead to serious kidney damage. It's important to drink plenty of fluids to prevent dehydration and to report any signs of dehydration to your doctor or pharmacist. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. Remember, this is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed. If you take too much Xigduo XR, it can cause a serious condition called lactic acidosis. This is more likely to happen if you are older, have kidney or liver disease, are dehydrated, have heart failure, drink a lot of alcohol, have surgery, have certain X-ray or scanning procedures, or are taking certain drugs. Your doctor may tell you to stop taking Xigduo XR for a short time if you have certain conditions. If you experience symptoms of lactic acidosis such as unusual tiredness, dizziness, severe drowsiness, chills, blue/cold skin, muscle pain, fast/difficult breathing, slow/irregular heartbeat, or stomach pain with nausea/vomiting/diarrhea, stop taking Xigduo XR and seek medical help right away. Before taking Xigduo XR, it's important to inform your doctor if you are allergic to dapagliflozin or metformin, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, inform your doctor about your medical history, especially if you have breathing problems, kidney disease, liver disease, pancreas disease, alcohol use, yeast infections, dehydration, blood problems, or vitamin B12 deficiency. You may experience blurred vision, dizziness, or drowsiness due to low or high blood sugar. Avoid driving or using machinery until you are sure you can do so safely. Limit alcohol intake while taking this medication, as it can increase your risk of developing lactic acidosis, low blood sugar, and high ketone levels. Certain conditions such as high fever, sweating, diarrhea, or vomiting can cause dehydration and increase your risk of lactic acidosis. If you experience prolonged diarrhea or vomiting, stop taking the medication and seek medical help. It may be harder to control your blood sugar during times of stress, illness, or reduced food intake. Consult your doctor for any changes in your treatment plan or medications. Inform your doctor before having surgery or any X-ray procedure while taking Xigduo XR. Older adults may be more sensitive to the side effects of this drug. Discuss the risks and benefits of using this medication during pregnancy with your doctor. It may cause changes in the menstrual cycle and increase the risk of becoming pregnant, so consult your doctor about using reliable birth control. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of any potential interactions with other medications when taking Xigduo XR. This can affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Before starting, stopping, or changing any medication, talk to your doctor or pharmacist about how it may affect your blood sugar. Keep an eye on your blood sugar levels and share the results with your doctor. Let your doctor know if you experience symptoms of high or low blood sugar. It's also important to note that beta-blocker medications may prevent the usual fast or pounding heartbeat sensation when your blood sugar falls too low. However, other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. Additionally, Xigduo XR may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this medication. And remember, always consult with your doctor before making any changes to your diabetes medication, exercise program, or diet. If someone has taken too much Xigduo XR and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. Overdosing on Xigduo XR can lead to lactic acidosis, which may cause symptoms such as severe drowsiness, severe nausea, vomiting, diarrhea, rapid breathing, and a slow or irregular heartbeat. It is crucial to get help right away in these situations. Remember, Xigduo XR is prescribed for your specific condition and should not be shared with others. It's important to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. Make sure you know the symptoms of high and low blood sugar and how to properly treat low blood sugar. Also, be sure to check your blood sugar regularly as directed. Before starting Xigduo XR, you should have lab and/or medical tests done to check kidney function, liver function, blood sugar, hemoglobin A1c, ketones, complete blood counts, cholesterol, and vitamin B12 levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. As for the daily dosage, your doctor will determine the right amount for you based on your individual needs. It's important to take Xigduo XR exactly as prescribed. And when is the best time to take this medication? Typically, it's recommended to take it in the morning with your first meal of the day. However, always follow your doctor's instructions for the best results. If you forget to take a dose, take it when you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your usual time. Don't take a double dose to make up for the missed one. It's important to store Xigduo XR at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product as instructed by your pharmacist or local waste disposal company. Remember not to flush medications down the toilet or pour them into a drain unless specifically directed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.